Today on the Dance Reel podcast, I'm speaking with Dr. Melanie Fuller. Melanie is a researcher and lecturer in physiotherapy. As an advocate for safe dance practice, Melanie continues her clinical physiotherapy practice and has 18 years' experience working with dancers from professional to recreational levels. Melanie is also a former dancer and someone I trained with full-time in classical ballet. This episode is such an important one to listen to. Melanie shares so much research-based information and also her personal experience as a dancer. Before we dive into this episode, I would love a favour from you. To help us bring some wonderful guests to our show and grow, please subscribe or follow this channel, like, comment and share with a friend. That would be a great help. Thank you so much. This episode was sponsored by Master Dancer Mindset. Know yourself, be yourself, and express yourself on and off the stage. Oh, hello, my beautiful friend, Dr. Melanie. It's so good to have you on my podcast. Thank you for taking me up on the invitation.
It's so nice to see you, Kate. It's been a little while, but thank you so much. I'm looking forward to our chat.
It's important, the chat and information you're giving us today. So really grateful for that. But for the listeners, Melanie and I trained full-time together at the Marie Waterman Academy of Dance, and that's how I met Melanie. And always so intelligent and such a beautiful dancer. We had some good times together and stayed in touch over the years. It's been a beautiful friendship, and I love the work you're doing now.
Absolutely. I look back so fondly to our time when we were in full-time training back in Newcastle. It was lots of fun. It doesn't seem that long ago.
I know.
But yeah, it's been so good to stay in touch with you, Kate, and hear all these good things that you're doing. I'm so impressed with this podcast. It's great.
Oh, and you're working in the world of helping dancers with their physical well-being, well-renowned physiotherapist. So what drew you from being a dancer to then stepping into a dance-specific injury research? And how do those two worlds influence one another?
Well, I think it comes back to my own personal experiences with physiotherapy and the injuries that I sustained while I was dancing. Mm-hmm. So my first experience with a physiotherapist was when I was commencing point work. I went to have an assessment just to guide that process. I did sustain some injuries along the way, so I went off to see a physiotherapist pretty quickly, or other health professionals as well. And I had dance screening, so I was getting good information from physiotherapists about my body and how to help my dancing. So at a young age, I learnt that physiotherapists are professionals that help dancers. And I was also hearing about elite athletes, how they'd go off to the gym and do conditioning, and they'd be taking part in sports science sort of testing. So I was interested in that and, how that would translate into the dance context. When I finished my dancing, I went back to university and I did exercise science and physiotherapy. So I graduated and became a registered physiotherapist and started working with dancers and seeing the variety of injuries. But I went on to do postgraduate studies, so I did my master's in musculoskeletal physiotherapy as well as sports and exercise physiotherapy. But I had some questions from the clinic over my years of practice. So that urged me to do my PhD and do more research. So I looked into reducing the risk of injury in dance. And I'm still researching and I'm still working clinically part-time, and I'm learning from dancers in the clinic, which is guiding my research as well, aiming to keep dancers dancing for longer. And just generally, we want to understand how to optimize participation in dance.
That's wonderful work. When I had my school, you also came down as the physiotherapist for my students' pre-point assessments, and they were really good workshops you ran. That was back in like 2012, around that time. Would that be right? Yeah, 2012.
That sounds about right. I can't remember exactly, but yeah, absolutely.
I've got some photos of you. Maybe I'll find them and put them on for the YouTube. But yeah, and that was really important for me when I had my school, and being your friend, obviously, keeping me informed on what's the latest safe dance practice. So what are you finding now are the biggest problems in our industry? So what kind of common injuries are you seeing with dancers?
Well, if I talk broadly about the types of injuries that happen in dance, there's sort of two categories. There's overuse injuries and traumatic injuries. Okay. So traumatic injuries are those ones that there's a clear moment in time when something's happened, someone's had an accident, like rolling your ankle. So a lateral ankle sprain would be the most common traumatic injury that would happen in dance. But
Yeah.
then overuse injuries are actually more common in general.
Yeah.
And they're those injuries where it's not so clear when there was a moment where something happened that the injury has come on gradually.
Yeah.
Um, and the most common site of injuries would be the ankle, but generally just the lower body. So
Yeah.
we do see injuries commonly at the ankle, the foot, shin and calf, knee, thigh, hip, and lower back. That's not to say there's not injuries in the upper body as well. They're just more common in the lower body. So I think the most common injuries, specific injuries
Mm.
that I would see in the clinic would be posterior ankle impingement, as well
Right.
as medial tibial stress syndrome, which is otherwise known as medial tibial periostitis.
Yeah. Have injury patterns changed in recent years, and what factors might be driving these changes?
I don't think we can say for sure that injuries have changed over the years. I'm not aware of specific research. That's not to say that we see changes in injury
Mm.
patterns in different contexts. So, pre-professional dancers versus professional dancers, or recreational dancers, or ballet versus musical theatre dancers, but even different repertoire or different roles that dancers might be doing, and different patterns that we see for males versus females. But if I think about recent times, COVID was an
Yeah.
interesting time.
Okay.
So I've had many chats with dance teachers, health professionals about there may have been some changes in that time. And perhaps that was related to many dancers were training at home, not in that more open environment of a studio. So they might have been a little bit limited on how high they could lift their legs or how many jumps they could do if they didn't have
Hmm.
that flooring at home. And things like pirouettes don't really work on carpet, might
Yeah.
have been an example that dancers were dealing with at home.
Yeah.
But then coming back into the studio and being able to do more, which was fabulous. But there may have been some instances where it was a big jump in what they were used to during that time.
COVID crazy times, tricks and oversplits, and seeing a lot of that online advertised to younger dancers. And for me, in my experience, I'm seeing a lot of parents, for probably lack of information and awareness, going to these courses that might be, I'm seeing teachers manually pushing legs higher and higher, and they're able to do more and more at a younger age. Do you see any longevity negative effects of that? And if there are any issues from your professional point of view?
Of course, we want to promote safe stretching.
Mm,
And I'm always talking about strength-based training is actually what reduces the risk of injury and not the
yeah.
stretching.
Yeah.
So
Okay.
I would like to see the focus coming off stretching. I mean, we
Yeah.
know that dancers want to get their legs up high, and choreographers are constantly pushing the boundaries and coming up with new things, which is great for our art form. We want to see these things, but we
Yeah.
want to make sure that it's appropriate to the individual in front of
Yeah.
them. Professional dancers have more experience with dealing with these things and have developed their own voice and can understand how to adapt things to look after themselves when they're exposed to things that were unforeseen. But then younger
Mm,
dancers, I think in those training contexts, it comes down to dance staff, dance teachers, choreographers to take that responsibility to make sure that dancers are ready for what
yeah.
they are asking them to do, that it doesn't look really different to what they've done recently, so
Yeah.
that there's gradual and gradual increases.
Mm.
And that it's appropriate to the physiological development, that growth development, as well as training development that young dancers are going through.
I've had a bit of judging work over here in Europe, and the same thing happens in Australia where teachers will put movements on stage that the students are just not ready. They're not physically strong enough. Like I'm seeing lots of fouettes in second with hip placement that's off, not that supportive leg underneath, posture gone, but they're wanting to keep up with this whole thing of doing tricks. And when watching, I just think, oh, I hope they're not going to injure themselves. And so I also am seeing from that world of dance, teachers maybe the pressure of wanting to put the tricks in before the student's really ready to be able
Mm.
to do those things. I don't know how many injuries happen because of those things, but I definitely see a lot that just aren't ready for those things to be on stage, and lots of aerials. And yeah, so it's very interesting. The dance world has definitely changed in the last 10 years.
It's interesting to hear your insights. I'm a big advocate for slow and steady wins the race. I'm really a big fan of just layer by layer developing dance skills. And I can understand teachers are attracted to pushing those very talented dancers, but
Mm.
they're still going through growth and development. And I can see the benefits of consolidating that foundational training and building it up gradually and appropriately.
Well, that's a big reason why I wanted to have you on the podcast because I'm definitely seeing a lot of anxiety and even anxiety to keep up. I'm working with pre-professional dancers with mindset. Students disappointed they didn't get a part or they want to be seen and that they want this. And I'm like, but you're still so young. There is time. And I
Mm.
often use the tortoise and the hare. Like don't try and beat this. You don't want to peak too soon because you want to be in this industry if you do love it for the long haul, not just trying to get the wins now. Your time will come, and so yeah, I feel like there's also a bit of psychology within that that's also maybe contributing to some injuries of wanting quick fixes. So many quick fixes.
That's right. We don't always have that magic wand to progress that quickly and to heal appropriately. Mm.
Yeah, absolutely. And so, what are some of the common misconceptions dancers and teachers still hold about injury prevention and recovery?
I've touched on this, but my favorite thing to talk about is strength-based training.
Yeah.
So we know from research in sports that strength-based training is really successful at reducing the risk of injuries, not stretching, as I touched on before.
Yeah.
It's also proprioception work and neuromuscular control work that's really useful. But dance-based training traditionally is not that good at increasing strength and building that strength-based. So
Mm.
I like to encourage young dancers to commence an appropriate strength-based training program, but it's got to
Mm.
be age specific and
Mm.
appropriate to their training history, specific to strength-based training, like so they're gradually getting exposed to resistance training.
Yeah.
And it's also got to fit with their dance training. We know that
Mm.
dancers have long hours, so adding strength-based training to already high volumes of training could be a problem. So
Yeah.
it's looking for windows of opportunity within the training year where they might concentrate on strength-based training. So holidays is an obvious time. We want dancers to have holidays, but
Yes.
that is one opportunity when they can start strength-based training and be prepared to come back to start the year.
Yeah.
But other teachers sometimes might reduce the volume and intensity of dance based training, particularly at that beginning of the year, so that there's room for strength based training, so that it all matches each other and complements each other. So the dance intensity and the volume might gradually increase in hours and the number of jumps. The number of développés, the amount of point work, the number of relevés, things like that, so that the body's adapting positively
Yeah.
and trying to complement that in the right way and developing some strength and then maintaining it as those dance specific training loads are higher so that you're not progressing the strength based work at that time so that it might not lead to too much for the body. So we want the body to positively adapt so that we don't get injuries or fatigue.
And so, for dancers listening to this or their parents, who would they go to? Because I've seen lots of teachers online that are trying to then teach strength based training. They might be qualified ballet teacher, they might know it from their own experience at the gym. But how can we do it safely? Not to say that they don't know enough, but
Mm.
what are your thoughts on that?
Yeah, no, it's a good point. Teachers tend to be a one-stop shop for all information for dancers, and that's such a challenge.
Yeah.
Teachers do a fantastic job in the studio, but yeah, they can't be everything. So physiotherapists are skilled in that space,
Yeah.
as well as exercise physiologists or
Yeah.
athletic trainers in the States.
Yeah.
In Australia, we have specific training in strength and conditioning, so you can go and visit strength and conditioning coaches. So around the world, there's going to be different qualifications, but
Yeah.
they're the ones that I would more commonly come across in Australia, and that one example in the States as well.
Yeah. Great. And can people come to you for that?
For sure. Absolutely. I love
Yeah.
working with dancers. I'm still doing one afternoon per week in private practice here in Brisbane, where I live.
Oh, that's so good. Because you have worked across elite companies and tertiary institutions as well. What makes a training environment both high performing and safe?
It's such a good question, and how to articulate that succinctly is challenging. And
Okay.
I'd
Yeah.
love to hear thoughts from other professionals, dance teachers, and psychologists, I think, in
Mm.
particular. But I think in training, context, it's promoting a growth mindset that you touched on just before, Kate. So normalizing mistakes and errors, helping dancers understand that that's a normal process so that they
Yeah.
can learn from their mistakes,
Yeah.
and reflect on what they're experiencing in their bodies. So they're developing that self-awareness, not just in their bodies, but emotionally as well. And
Yeah.
just building confidence so that they just keep learning. But generally, I want to see promotion of good physical as well as mental health is so important, and a really healthy relationship with dance so that dancers can keep dancing across the lifespan, that it's a great form of physical activity. There are
Yeah.
many psychological health benefits as well from dance. So not everybody has to be pursuing a career in professional dance. And I love seeing more and more adults doing dance classes and things as well. But I get that it's a huge responsibility on
Yeah.
teachers. So I'd
Mm.
like to see support for teachers to develop as well so that they have the confidence to offer this sort of environment, and also supplying really good quality information to young dancers. So I might mention a couple of great resources that I'm aware
Yeah.
of.
Yeah.
I'm sure you're aware, Kate, and your listeners are aware of IADAMS, the
Yeah.
International Association of Dance Medicine and Science. So their website has some free resources.
Yeah.
And one that comes to mind that I constantly go to share with people is on nutrition. So
Yeah.
that we want dancers to get good fueling in their body to match the energy demands of their dance training. Some other resources I can think of are from the Australian Society for Performing Arts Healthcare, fondly known as ASPA.
Yeah.
So again, on their website, you can access some free resources, and I can think of resources on sleep to promote high performance. And they're
Yeah.
just two basic elements that we want to make sure dancers are getting right to try and
Yeah.
recover well from all their dance training. There's many examples now of different institutions that are really getting this right so that dancers are
Yeah.
thriving. I think it's fair to say we want to all be doing better, but I'm glad that we've moved past offering dance training the way it used to be offered, that
Yeah.
we're trying to bring science and, good practice into professional dance or into dance training. Mm.
Yeah. I've got more questions to ask you, but before I tip into that side of it, I wouldn't mind having a little reflect on what it was like for you full time, because you had to move away from home. And I'd love to know from an emotional point of view what it was like moving away from home, what it was like full time, and any emotional impact you had as well on deciding to not follow a dance career. What was that like, that
Mm.
whole period of your life?
Yeah. No, it was certainly a challenge for me moving from Coffs Harbour to Newcastle to
Yeah.
pursue full-time training. So apart from the increase in the hours of training, I moved and boarded away from home, so I didn't have my parents around. I was pretty lucky that I did have some family in Newcastle, so I think that was part of the decision why my parents and I made the decision to go to Newcastle, so I had some support systems around me.
Yeah.
But yeah, it was challenging. Like homesickness is a real thing.
Yeah.
Um, and, as a young person, you don't want to ask things of people. Everybody has different favorite meals, simple things
Yeah.
like that. And I did get injured pretty quickly. And then having to ask people to take me to the physiotherapist, I didn't want to do that, but I knew
Yeah.
I needed that. And I had some good people around me to look after me to make sure I recovered from that injury, which I did. But we've got to recognize that with young dancers moving away from home, it's not just that increase in training hours, and perhaps you're working with different teachers, so they tend to do more développés at the bar compared to what they were used to in their
Yeah.
old studio. So it's different demands on the hips that they need to get used to. So those
Yeah.
physical things can take maybe 4 to 6 weeks to
Yeah.
get used to make sure that dancers are adapting appropriately to it. But yes, the other psychological and social demands, meeting new dancers, wanting to impress, and moving to where other students have already been working in that studio, different to where you were. So you're, out of your comfort zone and things like that. One of your other questions was that transition out of
Yeah.
dance. I did pursue dance a fair way. Like I went to a tertiary institution, which I loved, but then I was reasonably unsuccessful at trying to pursue a professional career. I got some short contracts professionally. But when I came home, it was like, oh, what's next?
Yeah.
For me, I had always been thinking about physiotherapy and exercise science back in
Yeah.
those days when you chat to a career counsellor at school.
Yep.
So it did make sense for me. Like I did have a plan B thinking about that. Not that I wanted to go there, I wanted to
Yeah.
keep dancing, but I came to the realization that I didn't want to keep auditioning. I wanted to go home and look at something else that was more sustainable for me.
Yeah. Was there grief with that? Because that's something I haven't touched on so much in this whole podcast that I think is an important topic is grieving one identity and moving into the other.
Yeah, and there needs to be more support for dancers in that space too.
Mm,
I know other countries have some of that support, but not so much in Australia. There's been some programs on and off over the years that I've heard about.
yeah.
But yeah, and athletes experience that as well.
Yeah.
You so identify as a dancer.
Yeah.
You know, you're a dancer, and then suddenly you're not going to the studio every day.
Yeah, I was going to say, and especially as a young person, right? Because we train from
Mm.
such a young age. And so there's almost like this fairy tale dream. I once spoke to a psychologist about this, and I said, at what age does a person, can they actually say they have a true concept of what they would like to do for a living? And she said, you know, from 16, before that, you need to treat it like, not a fairy tale, but just a dream. But when they're at that age of 16, that's when they can begin to really make a bit more of a informed choice. And so
Mhm.
I just look at my little dance life before that, and it was like, I want to be a ballerina. And I think there was that association with this, like a bit of a fairy tale, but you know, as much as I love dancing as well. And
Mm.
then, you know, just for some, as they get older, I know there's so many listeners, like I have had quite a few parents that reach out. They're teenagers are at that age where they've done full time and then they've gone, I don't know if this is what I want anymore. And maybe that's also okay. That,
Mm.
that your dreams can change. You know,
Mm.
sometimes I feel like there's this old school narrative of, well, you failed or you didn't make it. And it's like, no, you did really well. And you've now decided to step into this. Whereas some do keep going and doing the auditions because they maybe, who knows, they want it more or for whatever reason. But
Yeah.
yeah,
No, I think that's a good point that it's okay to
yeah.
move on and there is a life after dance and that you can still be involved in dance in many
Mm,
ways and just going to classes and things like that to stay fit and healthy. Mm.
yeah. How can pre-professional programs better manage training load and transition periods to reduce overuse injuries? And I'm also going to say, because there are institutions like we've got Queensland Ballet, Oz Ballet, but there's also so many private schools that may not have the resources available to them.
And we touched on that, like that transition into full-time training can be a time when dancers get injured. And I spoke about my experience that I did get an injury that I recovered from, but it was pretty quick. It happened in my second week starting full-time training.
What was it again? I can't remember.
An ankle sprain. Yeah. So accidents happen.
Yeah.
But yeah, so we've talked about those many different things outside the studio that dancers need to get used to, but they're dealing with new teachers, increased volume of training. There could be new techniques that maybe they're doing more contemporary technique than what they've done before. So their bodies have to get used to that transition in and out of the floor type work, which is different on the knees and the thighs, and also more upper body loading, different partnering for both
Mm,
sexes, males and females.
yeah.
So, you know, building up that strength. I'm a big fan of push-ups. And I think it's wise to build up that dance training for 4 to 6 weeks that I touched on. So building up the number of jumps, the number of releves, the amount of point work, the number of times that you're lifting your legs. And before you're introducing those choreographic complexities and speed, things like that of some of those elements. So another transition period that we see injuries occur is at the beginning of the year. So again, I think it's wise when you're coming back after 6 week holidays, which is similar to dancers transitioning to full-time training. Maybe they're
Mm,
less inclined to go and do a holiday workshop, which can sometimes prepare a dancer for the beginning of the year because they want to stay at home longer before they move away. Whereas some of the other dancers are
yeah.
still at home, did that holiday intensive to help them prepare for the year. But for any dancers, I think we've got to recognise they've been on holidays for 6 weeks, have potentially deconditioned. Some dancers are really diligent and they're doing their strength training in the holidays, but it's thinking about what they were used to at the end of that previous year and taking some time to get them back to that level over 6 weeks potentially, so that you're not pushing some of that higher intensity work in training. And maybe that's giving some space to work on the strength training that I'm going to keep talking about and keep
Yeah.
promoting.
Yeah.
But those two things are common transition periods where it can be a little bit of a case of too much too soon when they're coming back at the beginning of the year and
Yeah.
transitioning to full-time training.
Yeah, great. What role do psychological or social factors such as perfectionism or competition culture play in physical injury?
So injuries are multifactorial. So you raise a good point, Kate. We need to respect the mental, physical, and social aspects to aim to reduce the risk of injury. So it's complex. And perfectionism is a commonly talked about thing in dance. So we want dancers to understand quality over quantity and not just practice, practice, practice to get it right. That could lead to too much repetition too soon and lead to an overuse injury. And I think it's useful to help dancers understand where they are within their own individual dance development journey and try not to compare themselves to others in the world of social media. They need to walk before they can run, sort of thing. So what I keep coming back to, it's slowly building up those loads appropriately. So they don't need to master 32 fouettes at a young age when that is a skill that's commonly performed on stage by
Yeah.
leading professional principal ballerinas around the world.
Yes. Yes. Thank you for speaking to that. When a dancer sustains an injury, what aspects of recovery are often overlooked beyond physical rehabilitation?
So guiding a dancer back to dance shouldn't be a time-dependent criteria. It
Mm,
should be a criteria based on appropriate assessments. And I'm talking about clinical assessments to determine, is the dancer ready to go back to that dance element? Maybe they're not back to everything in dance, but when is it appropriate to go back to the bar, for instance? So physiotherapists commonly use those criteria to guide when
yeah.
they can progress rehabilitation and to
Yeah.
guide when it's appropriate to go back to the studio. And there's also psychological criteria as well to recognize. So I like to work with sports psychologists to make sure we're optimizing that. Do dancers have the confidence to go back to the dancer? Have they addressed that fear of injury? For a couple
Yeah.
of examples there. So we just want to make sure that dancers are gradually building those loads back in the studio based on those assessment-based criteria, but also identifying the why an injury
Yeah.
happened. Could it
Yeah.
have been related to poor health?
Mm,
Has that dancer had inadequate fueling to match the energy demands of their training? So, would they benefit from seeing other health professionals, so sports dietitians, sports psychologists, sport and exercise physicians that I work with commonly? And that can be one of the positives that come out of injuries. We don't want dancers to get injured, but then they can address perhaps some identified deficits, whether it was a strength deficit or there was something in their health that led them to be more susceptible to injury. So the other thing I want to promote is sufficient time to get back, that people aren't in a hurry to get back
yeah.
to going to that competition. So
Mm,
it's up to the support systems around young dancers to help them understand that perhaps it's okay to miss that competition. And so their dance teachers, their parents, their health professionals around them to weigh up the risk benefit ratio, because we do see, if as much as I mentioned, a return to dance should not be a time dependent criteria, not pushing that time barrier and allowing for perhaps a lengthier recovery so that you're really addressing the why an injury occurred can be really beneficial. Set a dancer up for success, for better performance once they're back to everything they want to
yeah.
do in the studio,
Yeah.
as well as reducing the risk of subsequent injuries. So
Yeah.
I do see patterns of subsequent injuries that can happen injury after injury and in closer and closer proximity to the previous injury. So
Mm.
taking the time to get that initial injury right can help dancers perform at their best, as well as reduce the risk of those subsequent problems.
And do you find, Okay, I know for me, reflecting back on my experience, I felt a lot of shame when I got an injury. And then
Mm,
this paranoia of, does the teacher realize I'm actually in pain? And I would assume that they would think that it's not real. And I don't know where I got that from. I probably do.
mm,
Um, but I definitely, at my first ballet school, I, tore ligaments in my groin. And the physiotherapist said, you cannot dance for 6 weeks minimum. And the following week I was dancing because we had a concert and I was about 11. I was only 11. I was an 11-year-old kid. It wasn't necessary. And I danced on painkillers, but the pain of that afterwards, after still dancing on that torn ligament in my groin, um, I was on the couch for 6 weeks over the school holidays. I was in so much pain and agony, and I didn't have a choice. And this is way back then, but I think that set up in my head for when I was full time and got a couple of little not a sprain in my first couple of weeks, but I kinked my neck, then started discovering I had knee tracking issues. And I remember feeling really overwhelmed, but then there was this deep shame of like, I must be lazy, or all of these
mm.
little narratives going along with injury. So, yeah. Do you find the culture of some teachers maybe putting too much pressure on their dancers to not have an injury, or maybe some like an underlying narrative that if you get a niggle or something that you're that it's not real unless it's an actual break or something like that, unless it's
Mm.
something that's big. I mean, maybe as I'm talking in circles, that could be about dancers listening to their bodies, and if there is something niggly before something does break or sprain or pull,
Mm.
that they can listen to that and also feel heard by their teacher.
Absolutely. Listening to those niggles is useful, and it never hurts to get professional advice to try and interpret that niggle so it
Mm,
doesn't turn into something that's going to lead to you needing to have significant times off dance, which nobody wants.
yeah,
And you learn from these things. It's helping young dancers interpret what's happening in their body. So
yeah,
I've come across like lots of dancers that have incredibly high levels of body awareness and are so articulate at explaining what's happening in their body. And I love working with them to help them understand physiologically, so translating that into science so that they can understand what's a positive adaptation in their body and what's a negative adaptation to your body. And adolescents are not young adults to talk about. One of my colleagues that sort of talks about injuries in adolescence a lot. Adults need to help young dancers understand that it's okay to not rush back into the studio. And yeah, it's quite a load on young dancers that they feel like they're letting down their other team members because they might be in a group that they can't do, and all of a sudden the spacing needs to change. But that's okay. Sometimes that's what needs to happen to be what's most optimal for the health of that individual. As worthy as it is for, young dancers to really care about the rest of the team and their friends and all that sort of stuff, and they want to do the right thing by the teacher. And sometimes it's me, I'm the baddie. I just say blame the physiotherapist. I said
yeah.
no.
But it's good they're listening
um,
to the physiotherapist.
yeah, absolutely. I really hope that there's no fear for young dancers to visit a health professional nowadays, that it
Yeah,
doesn't always lead to us saying, you need to stop dancing,
yeah,
even though that might be appropriate sometimes. And
yeah.
maybe they can't do all their dancing to make sure they get better.
Mm.
Uh, but yes, I hope young dancers are comfortable to go and see health professionals nowadays. And then I'm happy to be seen as the baddie to support them to communicate what's right for them.
Yeah. Oh, beautiful. What do you wish every young dancer understood about body awareness and communication with health professionals?
I mentioned how injuries can be a positive, how they can learn about their bodies and develop that body awareness through that communication as a health professional. But I think it's also useful to learn a little bit of anatomy and to learn from error that we talked about. So to learn from mistakes and reflecting on what they're feeling in their body. So when a young dancer wakes up with sore calves or delayed onset muscle soreness, that's okay. They usually recover within 48 to 72 hours. But can they reflect on why did their calves get sore and overloaded?
Yeah.
That they have experienced that, which did mean they did a bit too much in recent time.
Mm.
So what did they do? A whole lot of relevés? Was there a whole lot of demi-point? Was it more jumping that led to their calves getting sore? Maybe it helps them sort of think, is my calf endurance up to scratch? Because I want to be able to do that much jumping. And then thinking, last week I only did 10 sautés and this week I did 1,000 sautés is an extreme
Yeah.
example. Encouraging young dancers to reflect on these things. And they do see that scaffolded progression in dance syllabus when they go
Yeah.
from a lower grade to a higher grade, how that progresses and that you gradually build up to double and triple pirouettes or grand pirouettes, and you gradually build up battery and complexity of fast footwork and your jumping and things like that. So helping them see that gradual increase, so they're developing their own body awareness, but also learning about other aspects in the body. So an example is second splits. Are
Yeah.
dancers feeling a stretch on their inside thighs,
Yeah.
which is what you're trying to achieve by sitting in second splits? Or are they just feeling it in the hips, which might just come down to the individual shape of someone's hips, the bones that make up the hip.
Yeah.
And then they'd be better off spending their time in different ways. But we want to make sure that dancers are feeling the right things in their body and understand that there's lots of different individual anatomical variations. So people will
Yeah.
feel things in different ways.
For teachers, what are the most important principles of safe dance practice to integrate into daily training and rehearsal planning?
So I think it's being aware of that too much too soon, that gradual build up of the things we've talked about. Um, so it's wise to foster those slow and steady progressions.
Yeah.
But on the flip side, because it is hard for teachers to be aware of every individual class that dancers are doing and what they're doing at school as well, and those other demands on the body, they've got their school exams or things like that, or different things happening at home that play a part in how the body adapts to the physical training that's happening in the studio. So as we've talked about, helping young dancers build their own awareness so they can self-monitor and helping them build their voice so they can communicate when something's not feeling right. I think they're really important aspects of safe dance practice from my world as a physiotherapist. Of course, respecting all the psychological safety that's important to recognise as well.
Yeah, the psychological safety definitely is a very important one as well. And so that students do feel safe to speak to their teacher if something doesn't feel right, where they won't feel shamed, punished, or the teacher not overly stressed about the outcome of performance. Bit of human first, we always advocate for here at the Dance Reel.
That's it, yeah.
Yeah. And are there any new technologies or assessment tools that are improving injury prevention or monitoring in dance training?
Yes, there's wearables that exist that your listeners would be aware of. There's commercially available
Yeah.
wearables in the form of watches, bands, and rings. Of
Yeah.
course, traditionally, dance students aren't allowed to wear jewelry into the studio, and there's safety concerns with that too. Don't want to
Yeah.
scratch someone if you're working closely with someone. So maybe they can't always monitor their activity via those devices in the studio, but
Yeah.
it's still useful to monitor activity levels outside the studio,
Yeah.
and not underestimate the activity that occurs when you just pop down to the shops to buy lunch because you
Yeah.
forgot your lunch that day and then getting back to the studio and perhaps it was in the heat and you got all sweaty and you got to think about hydration and those things as well.
Yeah.
So that information can be really useful, and particularly thinking about the day-to-day changes and the week-to-week changes, I think really harnesses that good information. But then there is technology in the form of inertial measurement units, which is not so commercially available, where devices can measure how many jumps has happened, for example. So
Wow.
research has typically only looked at those things on a one-off occasion. And I think the real benefit lies in that ongoing monitoring and looking at that relative change,
Yeah.
so the body's adapting positively. And yes, there's other technology that we use in the clinic for assessments. So things like force platforms and dynamometers will give digital output readings. So from force outputs, so you're getting an indication of strength. You can get measures for jump height and many other variables from a force velocity profile from jump testing. So yes, it's pretty cool, the things that are available
Wow.
nowadays. Watch this space; it'll keep evolving.
To be a dancer in 2026.
Absolutely.
So, looking ahead, what trends do you see shaping the next decade of dance medicine and education?
I think it's the technology evolution that
Yeah,
we've just touched on and artificial intelligence. Um,
yeah,
and using the data that comes out of these many different devices that are available now. There's a barrier at the moment for the resources that are available in different contexts to get a chance to analyze that data and then give feedback in a timely fashion. That can be quite a challenge. But
yeah,
I think technology is quickly catching up so that it's more readily available and you can more seamlessly use that information in a real time context. So that's really exciting. I can't wait to see what that's going to look like in the years to come. But yes, if we can really get that real time feedback on a
yeah.
day to day and week to week basis, I think that's going to inform getting training loads right.
And on a personal note, what keeps you inspired in your work and connected to dance itself?
Mm. My day job now is in academia, so I teach physiotherapy students and I do research in service, and I love doing research in dance, and I'm still working clinically part-time. So I love learning from the students and my patients when they come up with questions that maybe I can't answer straight away, but I go away
Yeah,
to try and answer that. And I enjoy that teaching side of things, and continually trying to explore new ways to deliver that information to
yeah,
optimize how people learn. So there's many parallels with what we've talked about with dance teaching as
yeah,
well. But dancers continue to teach me. I mentioned before, they have such amazing levels of body awareness and articulate to me what they're experiencing. So I like sort of translating that into science, and we learn from that and we can come up with research questions as well. Um, and more broadly, I just like keeping involved with dance because it keeps evolving. It is a beautiful art form.
yeah.
There is that pursuit of excellence, which I like to be involved in. And I want to just promote people to keep dancing across their lifespans to get all the health benefits. I want to just keep seeing how dance can inform other elite athletic pursuits as well. There's a lot we're getting right, so that let's keep dancing and enjoying dance.
Thank you so much for taking the time to answer all of our injury, health, physical well-being questions for the dancers and leaders of the future in dance. It's a really great resource you are.
It's my pleasure, and thank you so much for the chat, Kate. It's always great to talk about these things.